Okay, so hi, my name is Carrie. I'll be your student nurse today. I already washed my hands and did all of the pre-procedural steps. Okay, so I'm going to start by taking your vitals. So we'll take your temperature. Is there like stuff? Okay. Which we want between 96.4 and 99.1. 100.4 is going to be a fever. So how do we do vitals? Sorry. Is it like?
I didn't see them.
Okay, I'll just keep talking then. Okay, so next we would do blood pressure, which is the normal is going to be 120/80. High would be 130/80, and low would be low would be 95/60. Next we're gonna check your oxygen levels. We want that over 90. We'll check your pulse. That's gonna be between 50 and 95. Anything over 95 is gonna be tachycardic, and then below 50 is bradycardic. And we'll count your respirations, which we want between 10 and 20. 24 is gonna be tachypnea, and then less than 10 is the bradypnea. Okay. After that, I would do my neuro assessment. So I'm gonna ask you a couple questions. What's your name and date of birth?
Kelly, 10/7/93,
And what year is it?
2023,
Great. And where are you?
at the hospital.
Why are you here?
I think I have some injuries.
You have some injuries. Okay. Great. ANO times 4. Speech is clear and coherent. Thought content is logical. Do you feel safe at home?
Yes.
Great. So there are no psychosocial concerns. And then behavior is appropriate. And she is well dressed for the weather. So after neuro, I'm gonna do HEENT. I inspect the head and it's symmetrical, ears are symmetrical, eyes and eyelids are symmetrical, nose is symmetrical, and can you open your mouth for me? Mucous membranes are pink and moist, and I'm gonna check Perla. Stare right over my shoulder, I'm gonna shine a bright light. Okay, pupils are equal, round, reactant to light, and accommodating, and they're about 3 millimeters in size. Okay, so I'm gonna check your skin, and I have gloves on. So it is warm to touch, no excessive dryness, moist, and turgor. Returns to baseline in 1 to 2 seconds, so no turgor is present. There is one IV on the right
I think it was supposed to be right.
antecubital spot. Yeah, perfect. And it looks patent, intact. There's no erythema. Do you have any tenderness?
No.
No tenderness. And it doesn't feel hot, so no calor. And there is no edema. Okay. So yeah, there's no wounds that I can see, but there is on the leg a little bit of color and I think some edema there and some redness, some erythema. And it looks like you have a small and wound on your leg, is that true?
I think so.
Yeah, okay. Great, so it's okay. Okay, so that's the skin. And then the skin is, pain. So, are you in any pain today?
Yes, my leg hurts.
Your leg hurts, okay. Where were you when you first noticed pain?
I think I burned myself.
Okay. And is there anything that makes it better or worse?
No, it just has been stinging since it happened about 2 hours ago.
Okay. And is it a dull pain, sharp pain?
It's kind of like a stinging and it doesn't go away.
Okay. And then does it radiate anywhere?
No, it just is on my left
Just on
calf.
Left calf. Okay, so located on the left calf. And how long or what time did this first occur?
It happened about 2 hours ago when I dropped my curling iron on my leg.
Okay. So it's been happening for 2 hours and just today. Great. Have you taken any treatments at home for it?
No.
No. And are there any other symptoms besides just the pain on your leg?
No.
So next I'm gonna assess your heart and listen to the sounds there. This is the aortic, and you'll hear S2 there. It's also, sorry, I can't really hear that. It's also on the right sternal border, second intercostal space. And then we have the pulmonic, which is right here. And it is the second left intercostal space, left sternal border. And you'll hear S2 sounds there. And then we'll listen to Erb's point, which is right here. And we'll hear the closure of S1 and S2, and that is the third intercostal space, left sternal border. And we have tricuspid down here, and it is the fourth intercostal space, left sternal border. You'll hear S1 there. You'll also hear S1 at mitral, and that is gonna be the fifth intercostal space, midclavicular line. So rate and rhythm are regular, and there's no murmurs heard. Okay, so now I'm gonna give your lungs a listen. There's 5 spots anteriorly. Okay, 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. And lung expansion is clear or symmetrical, and lungs are clear bilaterally. No wheezing, no coughing. Do you have any sputum?
No.
No, okay, and there's no signs of nasal flaring or distress. So if you could sit up, I'll listen to the back. There are 9 spots posteriorly. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. And the lungs are clear there as well, and no coughing and no sputum. Okay, great. Okay, next we'll do GI. I'll listen to your vowel sounds. Okay, vowel sounds are present in all 4 quadrants. I'm gonna palpate really quickly. Here. Okay, are you having any pain or tenderness?
No.
Okay, so no pain or tenderness. Abdomen is soft, non-rigid. Okay, and when was your last bowel movement?
Yesterday.
Okay, and are you able to eat solid foods?
Yes.
Yeah, and how's your appetite?
Yeah, I would say it's normal.
Great, and you can swallow okay?
Mhm.
Okay, good. And GI, do you remember when you last urinated? Or GU, sorry.
Maybe an hour ago.
An hour ago, okay, and I don't know if you know the amount, but if you do,
I don't know the amount, but it was clear and it didn't.
it's clear, not cloudy. Okay, perfect. I'm gonna check your pulses. I'll start with the carotid, which you just do 1, and then the brachial, you do it at the same time, radial, same time. Sorry.
No, sorry.
And then femoral is right here, popliteal is back there, posterior tibialis here, and then I would have her take her shoes off, and so I could feel the dorsalis pedis pulse. And all of those are at a +2, which is normal. Bounding would be +4, and 0 is an absent pulse. Okay. So neurovascular. I don't see any pallor present. Are you able to move your fingers and toes?
Yes.
Great. No paralysis is noted. And do you have any numbness or tingling?
No.
Okay, no paresthesia. Noted. Okay. And then next we're gonna do musculoskeletal. Can I have you sit up
Sure.
and if you could take a few steps. Great, and then turn back around, perfect. Okay, gait is unwavering and steady. Posture is erect. I don't see any nodules on the joints, and joints, muscles, and extremity length are symmetrical. Okay, we're gonna test your range of motion now. So if you could flex and extend your head like this, and then extend, great, and then don't let me push in, perfect. Now elevate your shoulders, don't let me push down. Now press them, perfect. We'll have you flex and extend, great, don't let me push down. And then I'm gonna test your grip strength. If you could grab my hands, great, grip strength is strong. And then we'll have you flex and then extend, perfect. Oh, try that again. Don't let me push in. And then abduct your hip and then adduct in, great. And then dorsiflex and then plantar flex, and don't let me push down, perfect. Okay, range of motion is intact and grip, the strength is 5 out of 5. Okay, so now I'm just would say that I don't notice any drainage. Well, there is like a little bit of some whiteness here, maybe pus on the wound, but no serosanguinous drainage and no no like color and all of that, which I think I already mentioned. And then let's see, head was symmetrical too, so yeah, I would say that we would just clean the wound maybe, or do that and bandage it up and kind of monitor the edema. Bed is lowered to its locked position, side rails are raised, and caulite is within reach.